Hi, I'm Christina, and I'm going to be talking about influenza. So, what is influenza? Influenza is a highly contagious viral infection of the respiratory system. There are many different strains of the flu, which are constantly changing. There has been different timings associated with the flu and spreads. Common is seasonal, but there has been reports also of epidemics and pandemics in the past with the flu and different strains of the flu. So how is the flu transmitted? It is transmitted through contagious droplets associated with sneezing and coughing. People are contagious from 1 day before the onset of signs and symptoms to up to 7 days after signs and symptoms have been shown. People will start showing signs and symptoms 1 to 4 days after exposure, but most commonly people will show signs and symptoms after 48 hours from initial exposure. So the signs and symptoms associated with the flu, they normally occur in a very rapid onset, and some of the common symptoms associated with the flu are high fever, chills, headaches, muscle aches, cough, chest pain, shortness of breath, fatigue, loss of energy, loss of appetite, nasal congestion, and sore throat. So, who is affected by the flu? Anyone can be affected by the flu. It's a very contagious pathology, but those who are especially at risk are those who are older adults, individuals who live in closed quarters, people with compromised immune systems, diabetics, people with chronic illnesses such as chronic heart, lung, or kidney disease. So how is influenza diagnosed? So a doctor will do this through a comprehensive evaluation, but doctors will mostly go off the signs and symptoms of that the patient is having and will most likely diagnose based off those signs and symptoms and clinical findings. It is very rare that lab tests will be done or any radiology tests will be done for the flu. Most likely those kinds of tests will be done to rule out a different pathology. There has been shown that there has been rapid influenza diagnostic testing done, but these are like quick tests that you can do, similar to like the quick office strep test. But these have been shown for the flu to be very inaccurate. So they did develop one for the flu, this rapid test, but it's been shown to be very inaccurate, not very specific, and not very sensitive either. So the treatment for the flu is bed rest, increased fluid, and increasing fluid intakes. This pathology will probably resolve from 7 to 10 days. It should take about a normal person. People who are at high risk for complications, such as older people, they can be administered antivirals as part of their treatment, as long as the antivirals are administered 48 hours, so, within the 48 hours of the onset of the symptoms. So what are some ways that people can prevent the flu from spreading or people catching it themselves? The CDC recommends flu shot and the recombinant influenza vaccine for prevention. Anyone can take this, even pregnant people or people with chronic illnesses. The just only contraindication for this is that they have a severe egg allergy, severe allergic reaction to previous illnesses, or if they're younger than 6 months old. Other ways you can prevent the flu is avoiding infectious people, especially those who are contagious, and also covering your mouth when coughing or sneezing, and washing your hands and keeping up with basic hygiene. Some interesting statistics that I found associated with the flu. In the United States, with seasonal flu, the season is from late October to May. And in 2009, it was reported 36,000 deaths happened due to the flu, with 90% of these deaths being with individuals who are 65 years and older. Also in the same year, hospitalizations of the flu were 200,000 alone, with 60% of these hospitalizations being 65-year-olds and over. Also, I found, looking in my research, that the H1N1 was a labeled pandemic by the WHO in June 2009. There was 94,000 confirmed cases in 100 different countries. So that just shows how the flu can be very contagious in different strands of it. There's always constant changing of the flu, so it's very important. It was noted to get the vaccine every year to try to attempt to keep up with the common strains that are out there. Okay, thanks. Bye.